I'm a veterinarian to start out. And then being a medical background, and then I did my master's in microbiology and PhD in virology in the States. Then so I'm into the application of the bacteria in various phases. This application could be in the food, application could be in the medicine, application could be in the environment. Different applications it has, okay? When I was a student studying the bacteria that go into food manufacturing, yeah, I realized back in 1970s, how many of you were in college back in 70s? A lot of you were, I think, yeah. Right. Back in 70s, none of us heard the word biotechnology. It's not there. It's not coined at all. The biotechnology word came into existence back in 1975, 76 in that neighborhood, right, sir? Around that time. So I didn't know the organism I was working with also has therapeutic effect. Back in 1907, Dr. Mechnikov, Nobel laureate, he was a Russian microbiologist and a physician. He was an MD. He hypothesized human being can live long without diseases if you have a healthy gastrointestinal flora. Okay? That is back in 1907. When he got his Nobel Prize back in 1908, his Nobel lecture included, unbelievable, he said, gastrointestinal microflora, eco-balance dictate the longevity of the human being and the reduction of the diseases those days. Okay? But Dr. Mechnikov didn't know about probiotics either. That word was not coined. The word was not coined at all for a long time. Okay? So I was interested in this probiotics. Dr.Sanjeeva Reddy, where is Dr. Sanjeev? He left? Yeah, he left. He was the speaker before. He wanted me to talk about probiotic and calcium, bioavailable calcium. Okay? So with that, the effects of bioavailable calcium and probiotics on anti-aging and osteoporosis. My question has been to the medical community, why would human being age? This is the basic question for all doctors. Why would human being age? Because I got some bacteria, we manufactured bacteria, they're about 1 million years old. Believe me or not, they're 1 million years old. They're in the lab. We transfer them, and the organism has so much power, and it goes. It doesn't age, it doesn't anything, right? So I always had this inherent thinking, why would human being age? Yeah? We all know that. Age will get us sooner or later, but could I stall it a little bit? Yeah? Indian is not getting that many diseases because part of our diet is buttermilk, which has the probiotics. Indians are very brilliant. You know, they figured it out. If they eat the buttermilk, and they can override the infections. Okay, that's nothing but the probiotic, but it is not defined. It's not a defined probiotic. It is a hit or miss. You may hear it, or you may not hear it. Okay. Probiotics are essentially opposite to the antibiotics. One of the earliest discoveries, 1907, was the Dr. Mechnikov. In the 21st century, Dr.D.R.K.Reddy of AdFac Labs pioneered the concept of putting the probiotics into therapeutic drug. It has never been put as a part of the drug. Okay, that is where we got the patent on it. This is Dr. Mechnikov. By looking at his dress, he can see that he was from the early century. Okay, and then this is Dr. D.R.K.Reddy. He's in the audience here. It's nice to see somebody's picture who is in the audience. You know, normally you see when after they die, but here the candidate is here. Then these are the probiotics. The Streptococcus, they look in chains, like Streptococcus thermophilus, and then it is the Lactobacillus acidophilus. It's 1,000 mag. You can see that, just to give you an idea, how they look under microscope. It's a morphology of prokaryotic cell. I'm not going to take you through this because I will only give you a little insight into this. The probiotic bacteria, where did they derive this power? They're almost like drugs, really. They have such a powerful effect. Where did they get this power? In the nature, if you analyze the science, at the end of the day, all of you are scientists, at the end of the day, it's God's creation. We're all trying to understand God's creation, really. This particular cell wanted to utilize a special sugars and break casein, complex protein, but the organism didn't know. It took him 1 million years to generate 3 genes. These are called plasmids, the extra chromosomal gene. Extra chromosomal gene has been synthesized by the bacteria at the request to take care of the food that's available in the nature. So these extra chromosomal genes are the ones that are dictating the therapeutic properties of the probiotics. Or the same thing with antibiotic resistance. Antibiotic resistance is because of the extra chromosomal gene, which is not in our favor. Okay, the next one. In the stomach, you don't have any organism. 10 to 100 bacteria because of the pH, low pH. In the duodenum, organism starts, and by the time you come to the ileum, jejunum and ileum, 100,000 bacteria per ml. In the colon, you have almost 100 trillion. If you look at the human being, have you ever realized eukaryotic cell, the human cells, are only 10 trillion, whereas the bacterial population in the human being is 100 trillion. If you scrape all the bacteria and then make it, it's like the size of the fist. This particular thing is called organelle. You cannot feel it, but this has a specific function which is more powerful than the liver. If you kill all those organisms in the GI tract, it's all over. Notobiotic. You will not survive more than 3 days. Okay? So the organism has a tremendous power, and the world and the medical community has ignored this. This particular thing has been ignored. You ask me, how do you know? Right? Because I went from medical field, I went into pure basic microbiologist. So we were working with the viruses and everything, okay? Then being with my background, I was always curious to see what is going on in the human being, okay? Digestive tract, probiotics. Where do the probiotics stay? Like here. In the, if you look at the small intestinal tract, in the ileum, at the distal part and also at the middle part of the ileum, that's where your Lactobacillus acidophilus resides. And if you take the ascending colon, transverse colon, that's where you're finding the bifidobacterium, which is also probiotic, and also the propionibacterium. They reside in that area. So these are the organisms confirming therapeutic properties of the probiotic. Okay? I'll pass that. I'll pass this one too because I don't have time right now. I do want to let you know one thing. Not only human being gets diseases, bacteria get disease too. That's what I specialized in. My doctorate was on the viruses that kill bacteria. Okay? So all these probiotics also get infected with the bacterial viruses called bacteriophage. We don't call it virus for them, it's called bacteriophage. So this is what I want you to know, because this is coming up science. In the next few years, these organisms will pick up the diseases too. Okay? Now this is the Lactobacillus helveticus. It's a probiotic. It's the phage. It's a virus that infects the bacteria. You look at that head there and the tail. This is dead. It has only 40 genes in its head. These 40 genes will be inserted into the bacteria. Genes will integrate with the chromosome and multiply and kill the bacteria. So even if you are not sure the probiotics will survive in the GI tract either. Okay? Down the line, this is the upcoming research in the next decade. I'll pass these. You don't need all these. These are all different. This is from my PhD thesis. Medical uses of probiotics. Medical uses are reduction of lactose malabsorption, reduction of intestinal infections, reduction of coronary heart diseases, immunomodulation, and suppression of the cancer. You wouldn't believe what these organisms could do. Okay? Lactose, probiotics, lactose is a disaccharide. Okay? Lactose is present only in the milk, nowhere else in the nature. Okay? Lactose goes all the way to the ileum. There is a reason why God created this. In the ileum, you have beta-galactosidase or lactase enzyme. When the enzyme works, that from the epithelial cells is excreted, when the enzyme works, it breaks it to glucose and galactose, and then the glucose goes through the glycolytic cycle and produce lactic acid. Okay? Lactic acid is the one that literally reduces the pathogenic bacteria. Staphylococci, salmonella, the dysentery, diarrhea, and all those things. Okay? That's why this lactose intolerance, 55% of the people in the world are lactose intolerant. Okay? Especially in America itself, we have 60 million people are lactose intolerant. As we age, we lose the enzyme. That's why people cannot have milk. Okay? Now, there's another reason. When you can't drink milk, you're not getting calcium, then your bones are going to hell. Okay? Osteoporosis, osteopenia starts. Okay? Now, how do you eliminate that? That's what is anti-aging. And then reduction of intestinal infections, I'll pass that. Reduction of coronary heart disease. What does probiotics have to do with the coronary heart diseases? Probiotics, what they do, they have an inherent capacity to break the bile. When the bile comes into digestive fat, the bile goes back to the hepatic circulation to conserve the bile. That's why the body does it. But the probiotics have an enzyme to break the bile to taurine and choline. And then when they do that, the cholesterol molecule now goes into the feces rather than going back into the circulation. Having done that, the body is short of bile. So he has to synthesize it, draws the cholesterol off the blood. So you're inducing the hypocholesteremia, right? You can reduce the cholesterol that way. Okay, organism has the inherent capacity to reduce the cholesterol. So indirectly, it has the ability to reduce the coronary heart diseases. Immunomodulation, I'll pass this. This is a hard subject because these organisms, they will stimulate the antibody formation, they will enhance the systematic activity of the macrophages, and they also increase the interferon levels, and they also produce T killer cells. They increase the number of T killer cells, and they activate the lymphoid cells of the gut as lymphoid tissue. Okay? Next. Now I'm jumping to the calcium. Now we all know that about the probiotics, so now I'm going to go to the calcium. In the calcium is a hard subject again in the world. Okay, this is one of the factors for anti-aging, I can tell you right now. Okay? I just wrote an article last week for the United States. Okay, I write every 2 months for US. Okay, what we should do. I mean, being in the United States, I tell them, you're not doing right, you got to do this, I got to do this, okay? So one of the things we are writing right now is about the bioavailable calcium. Why is American, despite the fact he's drinking so much milk, so much everything, 1/3 of the population has osteoporosis? Okay? Now, why is that? Yes. So that means the calcium you may be eating, but it's not getting into the body. Okay? Right? Make sense, ma'am? There got to be reason, isn't it? Why are you eating all of this, but nothing is happening, okay? Symptoms of calcium deficiency, I don't have to tell you, you're all doctors. Bone fractures, joint problems, insomnia, nervousness, muscle spasm, irregular heartbeat, dental problems. Oh boy, look like I got all these problems. What is osteoporosis? Osteoporosis is a silent disease because bone density or the mass is lost without any signs of disease or sickness. This is the worst part of this disease. You will not feel it at all. And then, according to World Health Organization, is a bone mineral density which is 2.5 standard deviations below the peak bone mass, 20 years old, as measured by DXA, dual energy X-ray absorptiometry. Okay? This is just the definition, you're all aware of that. Okay? And then osteopenia is one step before that. A lot of people have the osteopenia. When you can catch a patient at osteopenia, you can reverse it. Calcium absorption, this is where I want you to concentrate. This is worth listening, this particular thing. Dr.D.R.K.Reddy and myself, we struggled 10 years trying to understand this mechanism. Okay? Pass this. Now if you look at it, when we eat food, let's say you took calcium, comes into the stomach, and then with the acid, it ionizes. Calcium is supposed to ionize. And then it comes into the duodenum, and then you have the pancreatic juices, and your liver is pumping your bile, and then right there, calcium gets absorbed, 90% of it. Okay? 90% of that should be absorbed right at the distal end of the duodenum. And it takes only 3 minutes transition time. It's not much there, right? Now, what happens, this is where aging comes in. As you age, or the woman after menopause, when the estrogen level drops, guess what happens? When estrogen drops, your gastric acid comes down, hydrochloric acid in the stomach. When you have the less hydrochloric acid in the stomach, your calcium is not ionized. Unless the calcium is ionized, it's not going to be transported at the distal end of the duodenum. It skips right there. When it skips there, the next route where you could get in is the distal end of the ileum. Okay? That is a passive transport. This is an active transport, which I'm not going to discuss again. That is a subject by itself. Active transport means calcium gets in through the channels, into the cell, and then to exit into the blood, you got to have the vitamin D, and you also have the magnesium ion. It's an active transport. It's not physical pull of the calcium. Okay? That is what the most efficient transport system. As we age, as acid comes down, it's not going to ionize. So you short this right here. So you're not getting that. So as the people age, they tend to lose calcium because of this mechanism. Next step, when it comes to the down here in the ileum, what makes that calcium get in? Probiotic. Probiotics lower the pH here, ionizes the calcium a little bit. Through passive transport, they shove the calcium in back on. Okay? Even if you are missing here, you can catch it here. Okay? Now, what did we do to stop it? What did we do? What is that I can do here? If God's creation is knock it off. Okay? You should bend, you should look old, your muscles go down. Yeah, they can tell, yeah, you're 90 years old, I can tell you, right? Now, how could I make 90 years man look like 55? How could I do that? If I could put that calcium back on in the way it should be, even in the woman, 50% or 45% of the American women, the Caucasian, North European descents, 45 to 50% of them have the osteoporosis in America right now because of this mechanism. And doctors are not catching this. Okay? They're only talking calcium. They're not talking bioavailable calcium. I got to give credit to Dr.Reddy. I wrote a small article at his request for not a paper. He read that. He called me back. He said, sir, I want you to write full journal article. I want the world to take advantage of it because my father went through this problem. I don't want others to go through. Okay? I wrote a big article. Today, he circulated that article. Please take it home and read it because this is all in there. Yeah? Now we all got it now because this is where the calcium absorption is. That's all I wanted to, and I told you all that. Effective age, as you age, you lose calcium. Female loses more calcium. Caucasian white, Asians have more osteoporosis. African black, Negroid population do not have much osteoporosis. And then smoking, you get osteoporosis, excess alcohol, osteoporosis, allergies, osteoporosis, lactose intolerance, more osteoporosis, intestinal infections, and these are all the things they will add up to lose bone so that you could look nice and old, okay, if you want to, okay? If you want to look old and terrible, you can follow those things, okay? They're nice menu there. What's the effect of calcium on hypertension, cholesterol, triglycerides, dental problems, obesity, and incidence of colon cancer? If you want to, I can continue. Okay, they do reduce hypertension, okay? The calcium does decrease hypertension. If you take 1,000 milligrams of calcium per day, 8 weeks, and an average decrease of 3.8 to 5.6 millimeters mercury for systolic, 2.3 for the diastolic blood pressure. These are all research-driven, proven facts. And then cholesterol, 1,800 milligrams per day, 6 months clinical study, reduced serum cholesterol from 349 milligrams per deciliter to 278 milligrams, significant. Triglycerides, same thing, 327 milligrams down to 213 milligrams with 800 milligrams calcium per daily intake. Dental problems, this is the beautiful part. Now you can stop going to dentists. I hope not too many dentists are here. They will knock me out there when I walk out, okay? Dental problems, believe me or not, if the calcium is not getting in, you're losing alveolar bone. Then the movement starts, bleeding. Right? Then we keep visiting dentists, okay? Now the research proved if you take the bioavailable calcium, you build your alveolar bone. Not only you don't have a dental problem, you look good, you look young, face does not drop. When the bone stays stronger, muscle stays stronger, you look young. That's the trick to it. That is the trick for the good looks. And also you could lose weight too. Obesity reduction with the calcium. Okay, that's about it. So if you have any questions right now, you ask. If not, I'll get rolling. Any questions? Calcium borogluconate? Yeah, excellent question, okay? That's not a simple question to answer, I'll answer. Her question is, if I am taking the oral calcium, how is that different than the calcium borogluconate, which you get the intravenous injection, okay? Brilliant question. That's exactly we did. We ionized the calcium. You ionize the calcium ahead of time, and then you push that as a dietary calcium. That calcium has same effect as calcium borogluconate. It may take a little time for absorption. By the time you come through the stomach, 4 hours, and then in 4.5 hours, it will be in the blood. Okay? But with injection, you could do instantly. Okay? And you don't have to. You don't have to give an injection if you're taking it. Okay? Ma'am, that answered your question? Okay, as a matter of fact, the whole concept of bioavailable calcium is that. See, we are trying to ionize it like calcium borogluconate, calcium gluconate, and then the calcium lactate, calcium citrate, calcium maleate. These are all soluble calcium. If you take the calcium carbonate, it doesn't. And the whole world, including Harvard Medical School, they're not paying attention to the calcium, despite the fact Western world is facing a trouble with this, leave alone Indians. Okay? Did it answer your question? Yes, sir. Brilliant question. Brilliant. How come all the women are asking questions here? What happened to men? Okay. Commendable question, ma'am. Yes, it does. Yes, it does. Because this is where the problem is. Again, science is least understood. Because this calcium preparation is going into the pharmaceutical industry, and the pharmaceutical industry rely on the food industry to manufacture it. See, I happen to be in the food industry, and also with a medical background. I can see this, what's happening. When they reduce the like your antacids and all those things, they do cut the calcium down. When you cut the calcium down, you're accentuating your osteoporosis problem. Yes, especially with age again. A young one can override. Now we have another theory for that. You might as well in your practice. Young one, you got to build the bone. Male and female. You got to build the bone before the age of 23, 22. And that is it. Okay? After that, you tend to lose the bone. Okay? But when you're strong at that age, so consequently what you need, like in America right now, 60% of the people are not getting enough calcium RDA. RDA is about 1,000 milligrams right now. 1,000 to 1,200 milligrams. But 60% of the population is not meeting RDA even in the Western countries where the food is abundant. Okay? Consequently, the younger one is not developing the bone density. As you said, if you put them on a medication on top of that, they got a problem.
I request Dr. Swarup, please to come over onto the dais. D.R.K.Reddy garu.
I also call upon Dr.D.R.K.Reddy to receive a bouquet and a certificate of appreciation for their active participation. Next to Kulchar Harnath.